everybody's very anxious when they come in for surgery, which is very understandable. The day before surgery, we organise an admission time, and the admission time really depends on equipment and what else is being done on the day. So on the day of surgery, you come in at your chosen admission time, having fasted for a few hours beforehand. After coming into the reception of the hospital, you go to the waiting area where nurses will check you out, take your height, take your blood pressure, and do the things to get you settled in and get ready for anaesthesia. This can often be one of the hardest parts for people because it's hard to predict how long you're going to be in the pre-anaesthetic area. If you're concerned about the wait, it's really important to speak to one of the nurses, and they'll often be able to get you a better idea about when you're going to go in for the anaesthetic, and you may even be able to have something to drink to keep you comfortable while you're waiting. You move from the pre-anaesthetic area to the theatres. At this stage, the anaesthetist will come in and say hi. They'll pop a drip in your hand and give you something to make you feel really comfortable and relaxed while we wheel you into the operating theatre. Most people don't like operating theatres because there's a lot of machinery, there's a lot of lights, there's a lot of people around, and that makes you feel nervous. But all the people there, they're trained to look after you, and we're really interested in making sure that people are comfortable when they're coming into theatre and when they're coming out. After you've woken up following the operation, you're in the recovery ward, and from the recovery ward you go up to the main surgical ward, which is on level 1 of the hospital. Up there you'll have pain relief. Most people can actually get by with tablets, and there's an advantage with tablets over intravenous painkillers because the tablets cause less nausea and the tablets last longer. The people who have more discomfort will often need to have what's called a PCA machine, or patient-controlled analgesia machine. This gives them a button that they press every time they want a dose of painkiller. This works very well. However, at night when they fall asleep, they may not get quite as much pain relief as they'd like. So usually the next morning we like to get rid of the intravenous painkillers and put pretty much everybody on tablets. That allows them to get out of bed and allows them to get walking. When you wake up from the surgery, you're allowed to have something to drink. We are quite keen on you having a little bit of water to sip and some ice to suck, just to get you ready and keep you comfortable. The following day is when the work begins. So day 1 after surgery, we want to get you moving and we want to get you drinking. It's really important that we have you safe for discharge when you finally go home. And we don't consider people safe until they're drinking over 1 litre in 24 hours and until they're able to do a few laps of the ward. Because we don't want people to go home and then have to be readmitted. That's a really unpleasant thing for people.